It is one of the most common condition encountered in both OPD as well as in examination, that is renal stones. Types of renal stones. There are four types of renal stones. One is calcium oxalate stones and triple phosphate or struvite stones, and third one is cystine stones and uric acid stones. So we'll go through each type briefly. So first one is calcium oxalate stones, which is the most common type of renal stones. So there are various types of calcium oxalate stones based on the um, structure. Monohydrate stones are of dumbbell shape, dihydrate stones are envelope shape, and spiculated margins has irregular margins, and monohydrate stones are the hardest stones. And what do we advise for the patient with calcium oxalates? Usually we think that increase in calcium intake will lead to the formation of stones, but this is not correct. So we should take more calcium to prevent the stone formation. You know how? Yes. So increase in calcium oxalate bind to the oxalate in the intestine and will help in excrete through the stools. So this is how oxalate excretes in the body. And decreases the formation of calcium oxalate stones. And we also advise patient to take less fat content food intake. So these are the two advices we should give to the patient, right? And another type of stone is triple phosphate stone. It is also called as struvite stones, also called as staghorn stone. Staghorn, on scanning we'll see staghorn's shape of pelvises. So we call them as staghorn stones. They are composed of calcium, magnesium, ammonia, and phosphate, right? So they are formed in alkaline stones. And I forgot to tell you, calcium oxalate stones are tend to form in acidic urine. You should understand the difference, right? So in alkaline urine, these struvite stones are formed, and they when they are infected by the proteus organism, right? What is the shape of these struvite stones? Coffin lid. As you can see in this image, the shape of the struvite stones are coffin lid in shape. And the next type of stones is cystine stones. They are also radio opaque, and shape of these cystine stones is hexagonal shape. See, they are hexagonal in shape, seen in cystinuria, as the name said, cystinuria. And how do we manage recurrent stones? So we'll give deep penicillamine is the treatment for the recurrent stones, right? And next one is uric acid. All these stones, calcium oxalate, uh, triple phosphate, and cystine stones, these are radio opaque, right? But uric acid is radiolucent. It is one of the most differentiating point about uric acid. What is the shape of the uric acid? Yes, glass shards. Glass shards. Just piece of glass shards are there. It has no specific shape, but we call it as glass shards, seen in tumor lysis syndrome, gout, etc. How do we manage recurrent stones? We give alkaptonuria, allopurinol, right? So these are the various types of stones, and main differentiating point is radio opaque in these three types of stones and radiolucent in uric acid stones. And shapes of each type of stones and organisms and some dietary advices for the calcium oxalate stones you should remember, and shapes and examples for these types. And how do the renal stones patient present? So mostly they will present with the pain. There it can be two types: fixed renal pain in the renal angle, and colicky pain, which is a waxing and waning type of pain, which is associated with nausea and vomiting. So it is one of the clinical feature. And the next presentation is patient can present with hematuria and hydronephrosis, and patient can present with loin to groin pain. Initially patient complains in the loin, pain in the loin, and which is migrated to the groins also, hydronephrosis, and Dietl's crisis, which is very important. Dietl's crisis is nothing but initially there is a pain and palpable, severe pain and palpable mass is there, which is followed by large quantity of diluted urine passage. So this is Dietl's crisis. And based on the site of these stones, pain may refer to that site. I will give you examples based on the site of renal stones. So if the stone is present in pelvis, the pain is loin to groin, remember. And if the stone is present in the upper or mid ureter, the pain is along the ilioinguinal nerve or obturator nerve. And if the stones are in lower ureter, pain refer along the ilioinguinal nerve. And if the stone is impacted in the intramural portion, then pain will refer to the stranguli, to the L1 L2 dermatome, right? These are the clinical presentations of the renal stones. And how do we investigate? Investigation of choice for the renal stone is non-contrast CT scan. This is the investigation of choice, you should never miss. How do you manage? There are various intervention modalities for the renal stones. So initially medical management. What is the medical management? Medical management first will give symptomatically. First line therapy is tamoxifen. As it how does it work? It blocks the alpha receptors, causes smooth muscle relaxation, which slightly moves down, then stones move down slowly and pass out. So these medical management is preferred only when the stone size is 5 to 6 mm. Interventions for the renal stones are extracorporeal shock wave lithotripsy, retrograde intrarenal syndrome, and uteroscopic removal of the stones, and percutaneous nephrolithotomy. These are various interventions to treat the renal stones, right? Thank you.